You want to start recording? Perfect. All right. Well, it is 12 o'clock, so we will get started. Welcome to the Taussig Nutrition and Culinary Medicine program, and thank you for coming today. My name's Lisa. I'm one of the dietitians at Taussig Cancer Center, and I will be leading this presentation. So, in today's session, we are going to talk about soft food, strong support, gentle cooking for GI comfort. So the program goals are to help cancer patients, survivors, and their families replace mealtime preparation fears with confidence. We will answer nutrition and culinary questions with evidence-based explanations. We'll replace displeasing meals with pleasing meal options, and we'll also enhance nutrition and culinary knowledge and skills. We will begin with a brief nutrition discussion and then get into the recipes and cooking with Chef Jim and Chef Gabby. Our focus, like I previously mentioned, is about a GI soft diet, and we want to also make sure that we silence our microphones since we are recording the program today and want to ensure the recording is free of extra noise so that others can watch at a later time. So, starting off with just some general nutrition tips. When you're healthy, eating enough food to get the nutrients and calories you need is not usually a problem. But when you're being treated for cancer, these things can be hard to do, especially when you have side effects or just don't feel well. Good nutrition is especially important if you have cancer because both the illness and its treatments can change the way that you eat. Good nutrition during cancer treatment can help you to feel better, keep up your energy and strength, help maintain your weight and your body's store of nutrients, better tolerate treatment related side effects, lower your risk of infection, and help you to heal and recover fast. So we're just going to jump right into the GI Soft diet, which is what today's presentation will be about. And the GI Soft diet may also be referred to as like a low fiber or low residue diet. All of those essentially mean the same thing. So a GI soft diet or a gastrointestinal soft diet may be recommended in certain situations. So that could be after surgeries like gastric bypass or specific surgeries for stomach or bowel cancers. It could be recommended if you have digestive issues like irritable bowel syndrome, ulcerative colitis, diverticulitis. And the GI soft diet comprises of foods that are low in fiber and easy to digest. So this allows the digestive system to heal and rest because it's not making it work so hard with all the extra fiber. Now, this diet is more limited because it is excluding foods that are high in fiber. And our ultimate goal is to still follow a balanced diet, even though it is limited. So, if this diet is needed for more than 2 to 3 weeks for whatever reason, we may need a multivitamin or a fortified nutrition drink in the diet to help meet that overall balanced nutrition. So I'm going to briefly discuss the GI Soft diet guidelines. And if you want to look at it more in depth, this handout is in the toolkit that's attached to today's session. But overall, this diet guideline goes through the foods that are easy to digest or okay to eat, and the foods that are more difficult to digest. So those foods that you want to avoid during that period of time that this diet is recommended. All in all, the foods that are to avoid really comprise of things with skins, peels, seeds, casings. Those foods that are higher in fiber and are more roughage, those are going to be to the types of foods that you're going to avoid. The foods that are easier to digest or are okay to eat are going to be those foods that are lower in fiber. So you can kind of see the differences between the two categories. For example, like for a protein-rich food, creamy peanut butter is on it, whereas we would want to avoid like crunchy peanut butter or chunky peanut butter. Those kinds of differences can be seen throughout these categories. And this just goes over more of the food groups and what to avoid and what are okay to eat. Again, a lot of the avoid columns are going to be things that are with nuts or seeds or skins. And those foods are going to be higher in fiber. So we want to avoid those food items during that period of time. Now, once someone is cleared to start a regular diet or is permitted to start easing back into a regular diet, we will counsel that person to look at the avoid or the difficult to digest category and say, okay, we want you to start to incorporate one of these food items, trial it, give it 2 to 3 days, see how your symptoms are, see if you have any side effects related to any sort of GI symptoms. And then from there, you can start to add in more of those high fiber foods. We don't want to overload the body at once and say, okay, introduce 6 of these food items at a time. We want to slowly kind of build back up to that fiber. Some additional instructions in regards to the GI soft diet. So we want to chew all foods slowly to a mashed potato consistency. Since digestion begins in our mouth, the more you chew, the easier it will be for your body to digest. You may feel more comfortable eating 4 to 6 small meals a day versus, 3 larger meals. We want to make sure that you're staying well hydrated, which hydration can include things like ice cream and popsicles, soups, jellos. All of that can count towards your total hydration. And then if you're looking at a food item that has a nutrition label, just looking at foods that have less than 2 grams of fiber per serving while you're on a GI soft diet. So next, I will stop sharing my screen and let Chef Jim and Gabby take over. These will be the recipes for today's session: chicken supreme, potato pancakes, and heavenly good and fudgy cupcakes.
Okay, thanks, Lisa. Gabby, we just got to pin this, right? I'm going to let you pin it. Okay, so first one we're going to do is all these, as Lisa mentioned, are for a GI soft diet. So I'll try to elaborate on all the culinary points that pertain to that. Okay, we're going to start off with our chicken. Okay, so we're going to have, I'm going to show you how real quick to fabricate this chicken breast. Okay. So what we have here is right now I got 2 pans. I have ice because I wanted to keep the chicken cold. So that's why it's on there. So now I'm just going to take a chicken breast that has no bones, no skin. But as you heard Lisa just show that that form on there, the guide for a GI soft diet, the do's and the don'ts, the top one for the animal products, it mentioned not to eat gristle. And so I'm going to try to bring this up so you could see it close. So here, and this is what happens when you go to buy this at the store too. It's a boneless chicken breast, right? You don't see any skin on here, any bones. It looks pretty clean. I mean, we manicured it and everything. But when you get it, it'll look just like this. But here's what's also in here that I would remove. I'll try to bring this up close so you can see it. Okay. See this tissue over here, right there, right where the tip of my knife is. I'm going to remove this and I'm going to show you how I'm going to do that. Now that's kind of chewy. Now, if you take chicken and you stew it or, braised it and you cooked it for a long period of time, this particular collagen tissue kind of gets a lot softer. But if you're going to just cook the chicken really quickly, like we're going to do now, we're going to pound it. We're going to put it in a pan because this way it doesn't take as much work. I would actually try to remove this for the GI soft diet. So I just take my knife, and they don't do this really in the store, and I just go right underneath it. So if you could see your blade underneath it and you point upwards, see how I'm removing this out? And now I pick it up and I gently, while I'm holding it up, I go back and forth like so, and I'm taking this right out just like that. There's one little more piece here, and I'm just going to remove it right here. Same way. Okay. And now this is gone. And what I want to show you is this is pretty tough, kind of. So see how, let's see how I could pull on this? It's pretty tough. That's tissue. I mean, I can't, if it was raw meat, I'd pull it apart. Okay. So we got that. So now we're just going to take our chicken. We're going to cut it in some. I'm trying to cut against the grain because the grain goes one way. If you cut against the grain, it'll be easier to pound and flatten. So I got 3 pieces of chicken, okay? Now, the other thing you want to be careful of is you're handling raw poultry. So right now I have from touching the chicken raw, if I would touch anything else or my glass of water or whatever, you just cross-contaminated that with your hands, right? So ideally what I'm going to do now is I'm going to take my knife, I'm going to put it into the sink. I'm going to lift up this cutting board. I'm going to set it on the side over here. And then I'm going to take this one glove off. I got plastic wrap already. Actually, I'm going to take both gloves off. Okay. I got plastic wrap here that I'm just going to, I got it cut and all ready for me. Okay. On a cutting board. So then now what I'm going to do is I'm going to take that chicken and I'm going to put it on another clean board that has plastic wrap on it. If you only have one board, you would just take that chicken, put it on a plate, clean your board, and then after your board is clean and dry, just put the plastic wrap back on it. And that's how you would handle that. Okay. So now what I want to show you, if you're going to pound chicken or flatten it, I always like to do it between plastic wrap. Okay. And here's why. Okay. If I do it between now I'm going to remove that glove. Okay. If you don't have gloves, just wash your hands in soap and water. And then, if you're not using gloves. Okay. So now I got the plastic wrap. I fold it over. I always like to take, this is a mallet. The chicken's on here. Reason I want to pound it on between plastic wrap. If there was no plastic wrap here and you pound it, you can actually disperse raw chicken on your table, your counter, or other items you have there. So you don't need to pound it hard. Thicker ones, softer ones, or thinner ones, you would pound gentle. If it got a thicker piece from where the thick part of chicken was, you could pound it a little harder, like so. And this is about all I'm going to do. Now it's got a thick side, a thinner side. The ones that are thicker and rigid, you would do that first. And then the smaller ones you would do second. And that would be more gentle. A way to tell how you pounded so you don't have thick or thin, all you got to do, if it's in saran, you could pick it up. And if you hold it to the light, you could see if you did a good job, made it even. Because think of it this way, if you hold it up and you see light spots, wow, you pounded it thin. If you see really dark and you can't see through it, you know it's still thick. So that's a good way. You could just pick it up, look, and if you see a spot that say needed more, you give it a little more. Okay, so now we have, thank you, Gabby. Okay, so now for flour, we're not going to use whole wheat flour. We're just going to use all-purpose flour is the type of flour that we're going to use. Okay. And now we're just going to take our saran wrap, open it up. We got our chicken. We got a little salt and pepper. You could season it whatever you want. We're going to put our salt and pepper on the chicken like so. And then we're just going to take it. We're going to put it into our flour. Gabby, can you turn the pan on and put a little olive oil in it, please? Thank you. So now you got a pan, and what Gabby just did, she took our pan, she turned it on, She's going to put a little bit of olive oil in there. While she's doing that, we take our chicken just like so, and we're dredging it in the flour. What we mean by dredging is this. If you don't want to just have lumps of flour that just fall off. So once you put in flour, then you want to like pat it dry. That's what we refer to dredging. See, so now it's lightly coated and you don't see any lumps still of flour sticking. That's what we refer to when we say dredging in flour. Okay, so we got our 3 pieces, and now we're going to try to knock off the excess flour so they're nice and lightly dredged. And now we go into a pan. Gabby, can you show them that we don't have that much oil in the pan? If you could see, there's very little oil in there. Okay, you don't need a lot. Um, okay, if you're looking to increase your calories as well as your protein, we're going to show you how you could do that. But we got our, because juice is going to come out of this chicken as well once we cook it. Okay, Gabby's going to start to cook that chicken. I'm going to remove my gloves, set the bowl on the side. Okay, now what we have in this pot that Gabby just lifted the lid from is vegetable broth. So you could buy it in a box or you could use chicken broth if you wanted to. You know, it's subjective up to you. Okay, we got our pan going. It's on a medium flame right now. And so what we're going to do is we got some chicken already done. We're going to cook this chicken on the first side. All of a sudden, when you start to see the proteins coagulate, it gets white on the side. And then all of a sudden, the flour that was white starts to dissipate. You see moisture coming up. That's what happens when it's going to be time ready to flip and turn. Any moisture inside that chicken, right, is going to come to the top because the heat is forcing it. That's a great indicator that it's time to turn this chicken over. And it doesn't take long because remember, we pounded it. It's really thin. Okay. So now it's starting to coagulate. We're going to pound it over. Once we turn this chicken over, then we're going to let it cook for a little bit on the other side. Then we're going to take it, we're going to put it in a pan. Now I got some of that leftover flour, okay? And what we're going to do with it is we're going to put it in the pan with the residual fat that was left in there. We may need to add some more. What that is going to make is going to be a roux, a thickening agent. Flour and water makes a roux, okay? So I'm going to try to show you now. Look at, if I bring this up real quick, the flour don't look white. The blood's coming to the top, the moisture. We turn this chicken over. It's beautiful, lightly golden on that side. We're looking really good there right now. Okay, we got it. You could take the top off the broth, Gabby. Perfect. We're good there. Okay, and I turned it off. So now we got our pan, we got our vegetable broth. All right. And so now, and the broth doesn't have to be hot. Ideally, when you make a roux and add it to a liquid, it's good to have, one cold and one hot. If you have a hot roux and a hot liquid, it'll bubble, bubble, bubble a lot, right? I'm only making it a little bit in the pan, so we're going to be okay. Okay, so look, you could see here's our chicken, and we're looking really good. We're done. We're golden. So now it's going to go into our pan like so. Okay, now we're going to I got a little bit of oil that goes left into the pan. We're going to make our roux. There's a little bit of that. We're going to add a little bit of flour to it. That makes our roux like so. And what we're going to do is we're just going to mix this in. Okay, like so. And we just got right now fat and flour. Okay. And I think I'll be able to tilt this pan so you can see what we got. And there's what we got right there. Generally, the classic ratio for a roux is equal parts of fat and flour. So if you had a teaspoon and a teaspoon or a tablespoon and a tablespoon, depending on the volume. Now, here's the other thing to consider when you make a roux. Now, if I keep cooking, it's going to get a little darker and brown. I don't want it too brown, but when you brown it, two things happen. One, it gives it flavor, okay? And that's just fat coming out of the pan. That's okay, Gabby. And what it does, it gives it flavor. But the more you brown a roux, the less thickening power it's going to have, right? So what happens is, just like in New Orleans or in Louisiana, when they make brown roux for gumbos or Creole dishes, the more you cook a roux, you're cooking out the starch. That's what happens when you cook it. You cook out the starch, but that also makes it taste better. Because if you had a roux that wasn't cooked out, then it tastes starchy and gummy like a gravy that wasn't cooked out. Okay. So now you could see, look, we got our flour. Now we're looking really good. You don't want this to be really thick. So this is subjective on your part, how much, liquid you want to make. We gave you amounts in the recipe that work really, really good. But now look how nice this is. See? But there's, subjective parts. How long you cook the roux will depend on how much liquid you're going to need in there to get the consistency you want. So we're really good right now. Okay, so if I could show you this Tilton, see how it drifts off? It's still loose, but it's going to cook more in the pan. We take it out. That goes in the pan with our chicken like so. That goes on the side. Gabby's going to cover it with foil. She's going to vent the corners. And then when she's done, that goes into the oven for about, 12 to 14 minutes at a 350. Corners are vented just like this. So some of the steam comes out. Then after 14 minutes, we take it off. We put 2 pieces of cheese on the top of it like so. And when you're done, here's what you'll get. Okay, so we got a spatula here, and here's our chicken. So we got no gristle. We took it out. This is Havarti cheese that's on the top. And here's our 2 breasts of chicken right here. And now we got our sauce, and we put a little bit extra sauce that goes down there, and you could see here's what we go. I'm going to set this on the side. I'll bring this up, and this is our chicken supreme. Okay, you could actually make it the day before if you wanted to and reheat it, and then you could pound them in smaller pieces or bigger pieces. So we're going to leave this one over there. Okay, we're going to get a new cutting board. Set that one there. All right, next recipe. We're going to make potato pancakes, and these are really great. But to do that, to make it for a GI soft, we're going to show you what we did. So what we took was, you got a whole zucchini that's raw, right? Now what we did was we took the zucchini and then we peeled the zucchini. After we peeled the zucchini, the part that we want to use, if you look at the whole zucchini, see the part where the stem is? This whole top part from the stem to the center right here, from the stem to the center has less seeds. I'm going to show you what I mean. So if I cut this in half like so, okay, this part has less seeds. This part has more. Here's what I mean, but I'll actually, let me grate some and then I'll show you. I'll cut it in half. Okay, so we take the part that doesn't have, from the stem that has the least amount of seeds, we're going to put it on a large hole grater like so, and we're going to grate it. And what happens is, after we grate it, this is what we're going to get. It'll look just like this here, right? Just some grated zucchini. Real quick, what I want to show you is, if I take this part and cut it in half, here's the difference. That's why we use the neck. This is the back part. See all the seeds? This is the front part. See how it's much less, right? And see how the solid part of the zucchini is really thin here, but look how thick it is over here, much thicker. So I could grate this without getting into the seeds. So I wanted to show you that. Okay, so now once we got that part done, all right, we took it and then we blanched it. Now you could blanch it in water, you could blanch it in vegetable broth. Then we take it, we blanch it till it's nice and soft. We cook it till it's soft, strain it out. You can see here's still the carrot from when we strained it. And then when you're done, that's what you get. Grated, no skin, no seeds, blanch, soft. Okay, so now we're going to take potatoes that we peeled. These are golden potatoes. They're raw. We're going to drain them in a strainer like so. Okay, and we got raw potatoes right here. All right, I'm going to set this on the side. I'm okay, Gabby. I'm just going to just do this here. We're good. Okay. All right. So now we got our raw potatoes. We got our blanched zucchini. And the same, this is a peeled carrot. Same thing with the carrot, just grated on the large hole of a box grater. We got that. Okay, so now we got some almond milk. Okay, we got a little bit of baking powder, and we got all-purpose white flour. Normally we would put in grated onion, or onion that we would, dice and saute. We're not going to do that for a GI soft. We're going to use onion powder instead, and we have our onion powder here. We take our potatoes, right, and they go into the blender like so. We put in our almond milk into the blender like so, okay, and we're just going to take mix this up like so, okay, just like that. We're going to turn it on, and we're going to blend this. Okay, now we got liquefied potatoes, all right? Now we're going to add in our onion powder to our flour, our baking powder to our flour, right? We're going to take all this, get a spoon, okay? All right, we're taking our dry ingredients like so. I'm just stirring it a little bit, and it goes right into our batter. Okay, now we're going to take this, and we're going to do it again to mix all that in nice. Okay, we got that done. That comes off. All right, we're going to set that here. We're going to take our bowl from here. All right. And, oh, you got that bowl there. Good, Gabby. Okay, so here's what we got. Here's our pancake batter. Look, see what we got? We're going to just pour it out. That was raw. And this is a lot easier than trying to grate a raw potato, you know, and then they get greasy from all the oil as well. Now we're going to take our batter. We're going to fold in our zucchini and our carrots into this batter, just like so, okay? And we're going to mix that in and see what we got going here. I can't tilt it too much, but you could see there. Okay, now Gabby's going to take her measure. She's got a 1/4 cup measure. Oh, I know what we're going to show you. Yeah. So Gabby, look at, she didn't put hardly any oil in. Look at that. So she took a towel, she rubbed it with oil, put it in a non-stick pan. You don't need a lot of oil at all, right? So these won't be greasy. And now she's got the pan, she turns it on, got about a medium flame, 1/4 cup scooper, and she's going to put 1/4 cup increments in there to make a nice pancake, and she's going to cook that pancake. Okay. So it's that easy to do. There's the blender. We just pureed it. It works really great. We make these at home all the time. Well, if you're not following a GI soft and you don't need to, you could just use raw grated carrot and zucchini and put it in there and it comes out great. Okay, and onions or whatever you want. But for a GI soft, that's what we want to do. Okay, we're going to set this aside. And so now while the chicken's in the oven, Gabby's cooking the pancakes. Now we're going to do our dessert. Okay. So for dessert, we're going to make cupcakes with a cashew whip icing. All right. So we got to make first we're going to make our frosting. And then after our frosting, we're going to make the cupcakes. Okay. So for the frosting, okay, we got cashews that were soaked in water overnight. Okay. We got cashew butter. Okay. That we're going to put in there as well. And I need this spoon right here. Okay. So we got cashews. We got some cashew butter as well. Okay. If you wanted to use almond butter, you could do that too. All right. Okay. But this is what we're doing. And then we got our raisin reduction, which is nothing more than raisins and water. We did this on previous episodes, how to make it. Equal parts of raisins, water, put them in a covered pot, 15 minutes. Raisins will rehydrate. Water will reduce down to about 3 tablespoons. Put it in a blender, blend it, and it comes out like baby food. We got our almond milk, and you have the recipe that we're sending to you for the exact amounts. We got our almond milk. We got vanilla that goes in. Okay. We got a little bit of real maple syrup. All right. We got a little bit of salt. And then finally, our unsweetened almond milk that goes in. Okay. And we're just going to take this, we're going to blend it up. All right. I don't have to do it the whole way because we got some already done, but it's a lot like making the cashew names. Okay. So we would blend this for about 2 minutes so it's nice and smooth. And this is what happens after a couple minutes. Here's what you're going to get. That's the icing for the cupcakes. And you just saw how we made it. That's our cashew whip. Okay. Okay, yes. So what Gabby's going to do, she just took that out. Now she's going to put sauce over it. And she has a slice of Havarti cheese. And Gabby will put the cheese on and she'll put it back into the oven now. And that's exactly how we did that. Okay. And, if you want more gravy, you could do more. If you want less, you could do less. You don't have to do any at all. But we'll leave that part up to you. Okay. All right, so now we're going to set this aside and we're going to get our cupcakes. And here's everything to make our cupcakes. Okay, right there. All right. So we got that. So we got our beets. Okay, here's our cupcake. All righty. Okay, so to make our cupcakes, all right, we got a food processor where we took beets, and our beets was we took beets that you could buy in a can or in a jar. So they're cooked beets, not pickled, not anything like that, just plain cooked beets. And we put them in a food processor and made it just like baby food, pureed beets. That's all it is. If you drained them really good, and you might need a little add a little bit of water or the beet juice to make it smooth like that, but that's what you want. You want nice smooth puree of beets. Okay, and here's our cupcakes that we did before. Okay, great. Okay, so now what we have is we got our bowl. Okay, like so. Okay, so we need our beet puree. Okay, our puree goes in of beets, just like that. All right. So we measured out 1 cup of the puree of beets. That goes into our bowl. And then we have some unsweetened almond milk here. Okay, that's going to go in. And we're going to whisk this in just like so. Okay. Okay, we got our beets, almond milk. Okay, we're going to add our vanilla. We're adding more raisin reduction. Again, right, that's our sugar is our raisins. I mean, these are really healthy cupcakes, and they'll be great for a GI soft. And then we got some extra virgin olive oil that goes in. That's going to make it caloric for you. Okay. And so these are our wet ingredients, and we're just whisking it in and mixing it in so it's all blended really, really well. So you can see right here, everything's blended good. Okay. So that's our wet. That goes over here. Then we take our dry. So our dry is going to have our flour. Okay. That goes in like so. Okay. And then we got cocoa powder. Okay. Our cocoa powder goes in. All right. And then we got our baking powder. That goes in. That's our dry. We're just going to mix our dry together like so. Okay. Once the dry is mixed in, it goes into our wet. We set that aside. Now we take our wet and dry, and we're going to mix the two together. Okay, like so. And then we're going to fold in 70% cocoa, dark bittersweet chocolate chunks. Okay, so this gets mixed in. You want to make sure you don't have any lumps. All right. So now we got our cupcake batter. I'm going to lift some up so you could see what it looks like. As soon as I get just a little more mixing here. Okay, now we're looking really good. And here's what it looks like. That's our cupcake batter right there. Take our chocolate pieces, or you could buy chocolate nibs. We're going to fold that in now. That was the last piece. If you get 70% cocoa, dark bittersweet, a good chocolate, it'll melt in your hand. So it's not hard, right? Good chocolate will melt. Your body temperature will melt good chocolate. Okay, so now we're going to take our different ways to make our cupcakes. So most people have a muffin tin. All right, I'm going to move this to give us a little more room. Set this aside. So we have a muffin tin. And then so you could take, if you don't have, you could use silicone cups, right? So we got silicone cups here. If you put it in a silicone cup, they will pop out really easy. Or you could buy a whole silicone sheet like this here, right? And then they just pop out like that. If you don't have silicone, then you would just use a paper liner in a cupcake pan. And then basically what you want to do is then you take the batter, okay, and then you're going to fill this up, whether it's in the paper or the silicone, to about 3/4 full, just like so, like that. Or if you do the silicone the exact same way, okay, same thing, and try and then you use all the batter until all 12 cups are somewhat evenly filled. So that's how we would do that. Set that aside. Okay, when it's done, okay, we take a rack once they cool, okay. Now the silicone, you could see what you could do. Look how nice. See, it just pops right out. So you could do that, and then we put them on the rack to cool. Or if you used a paper liner, just put that onto your rack and allow that to cool. Okay. And then the last thing that we do, okay, is once you get the cupcake and you get your cashew whip, right? Now we take our cashew whip, just put it onto your cupcake, and you got a healthy, really good cupcake, a healthy icing, right? And here's our cupcake, and I'll cut one in half so you could see it, what it looks like over here. Okay, you can see the center of this thing. It's beautiful looking. It's fudgy, it's gooey. That's what the center looks like. I'll bring it up close. Actually, I'll just put it on here and bring the whole plate up close. Okay, Gabby just took the pancakes out of the pan. We'll bring them next. So see what it looks like there? Look at it. This is a beautiful cupcake. You don't want to overbake them. There's our cashew. You can put as much or as little cashew icing you want on there. All right, we'll set this here. And Gabby's going to show you how nice those pancakes. Turn one over and hold it up in front so they could see. So you could see, look how beautiful those pancakes come out. Yeah, they're hot, huh? They're hot, hot stuff. So look how beautiful they come out. So we got our pancakes. Our recipe is here. Here's the recipes we did. GI soft chicken supreme, GI soft zucchini and carrot potato pancakes. And then we have our chocolate fudge cupcake. And I think we were able to get it done on time. So, okay, we will hand it over to Dr. Umeda.
Okay, thank you, Chef. So give me 1 second. Let me prepare the slides. Going to share the screen with you. I believe everyone can see the slides, the PowerPoint slide. Oh, sorry. Okay. Yes, so nice to meet you, everyone. My name is Dr. Umeda from the Wellness Department, Center for Integrative Medicine, Lifestyle Medicine. Today, I wanted to share with just a quick one single slide, which is to explain integrative medicine. Maybe some of you have heard of it, or some of you never heard of it, about the integrative medicine. We also call it integrative oncology. So integrative oncology is an integrative medicine targeted for the cancer patients and or the cancer survivor. So what is the integrative medicine? If you could look at the left upper corner, this is a patient-centered, evidence-informed field of comprehensive cancer care that uses lifestyle modification, mind-body prosthesis, and also natural products or natural therapies alongside with the conventional cancer treatment. So simply speaking, we call it natural, anything natural or non-pharmaceutical things to support you, not to treat the cancer, do more like a supportive, physically and mental support. So the integrated medicine targeted, so we see integrated medicine, especially we see the non-cancer patients, such as people with chronic pain, migraine, headache, fatigue, digestion problems, something called irritable bowel syndrome, or overall weight management, overweight, diabetes, metabolic syndrome. But also we see the cancer patient to provide this some support from integrative medicine. We also call it holistic medicine. So that's we call it integrative oncology. So there are some cancer center have the integrated oncology services such as MD Anderson Cancer Center, Houston, Texas, Memorial Sloan Kettering in New York, Dana-Farber Cancer Center in Boston, Cancer Treatment Center of America in Chicago or Philadelphia, I believe in also Phoenix, Arizona, several locations. These major cancer centers already have the integrated medicine or integrated oncology program. So we also have that. So what we can do, so as you may know, we do like a nutritional counseling. There are some cancer specialized nutritionists, but also if you have a specific question about the diet, like you may found some information on the internet, like let's say sugar will feed the cancer cell. Is it true or not? Actually, it is partially true, but partially untrue because there's no definitive evidence or data that like sugar will directly feed the cancer. So providing you some correct information so that this is just an example. So that's what we do here. As to the sugar, consuming too much sugar, this will cause a whole body inflammation, inflammation in your brain, your joint, your muscle, internal organ, everywhere in the body. And this will may affect the cancer treatment. Yeah, so that is the bad thing about the over too much sugar consumption. So from that perspective, we recommend the low sugar diet, generally speaking. But again, there's no definitive data like a sugar would feed the cancer. So the question is, should I remove all of the sugar, remove all of the fruit, all of the carbohydrate? I don't think it's necessary. So some additional information will provide, or depending on the questions. We also have a yoga program, yoga specialist, meditation, holistic psychotherapy specialist, exercise program like a dancing or this overall general exercise. We also have a chiropractic doctors, massage therapy specialist, and also acupuncture. And also, depending on your questions, sometimes we can have a vitamin counseling because there are so many vitamins over the counter supplements and many people who wants to let this research on the internet, oh, can I take this vitamins or this kind of herbal medicine, anything natural? But we have to be very, very careful that we have to avoid the drug herb interactions. So sorting out this supplement is okay to take or safe to take. This is not okay. So sorting out this is one of my role as well. So doing some vitamin counseling. That's we can, if you have a questions, we can talk about that. If you see the left lower corner, there's a growing research evidence, scientific evidence for the cancer patient in this integrative medicine field. For example, chronic pain management related to cancer or cancer treatment. Acupuncture, massage therapy, meditation are considered to be beneficial. Their research data, chronic fatigue, yeah, exercise, yoga, acupuncture could be beneficial. Nausea, vomiting, acupuncture, acupressure, like doing some, which is also called shiatsu, like using a thumb, like acupressure treatment based on the acupuncture point. Chemotherapy-induced neuropathy, numbness, tingling, hands or feet. Acupuncture could be beneficial, massage therapy, like that. So for the each chronic bothering symptom, we can show you is there any research data, and based on that, we can give you some recommendations. So if you're interested in making an appointment, my name is Naoki Umeda, one of the staff citizen. So this is the phone number. You can see 216-448-4325. This is our department phone number. If you like to make an appointment, there's no referral is needed because again, we always provide anything, even if you're receiving any, let's say, chemotherapy, immunotherapy, molecular target therapy, any kinds of treatment, we always choose anything which wouldn't interfere your current treatment. So if you have a chance, you talk to your oncologist or surgeon or cancer specialist or maybe palliative medicine doctor and get a referral in the computer system, that'll be great. But worst case scenario, no referral is needed. So just give us a call. You can make an appointment. We usually work at Beechwood campus, which is our main office here. But also I have an outpatient clinic at main campus, Taoiseach Cancer Center in the second floor, which is the CA2, just once a month on the first Monday of the every month. But otherwise, I'll be at Beechwood. And also I can do the virtual appointment as well. So if you're interested in or any question, just call us and we are happy to help. So just wanted to provide you what is the concept of the integrative medicine or integrative oncology. If you have any question, please let me know, put in the chat box or just speak up, please.
Hello, can you hear
Yes,
me?
yes, I
So,
can hear you.
yes, thank you for the presentation. And I have two questions. I have been recently diagnosed with breast cancer and I'm receiving radiation therapy. So I found that I have a metallic taste in, I don't have any radiation, only on the chest and axilla, but I found that I developed like metallic taste with a lot of burping. Is this related to radiation or not? I don't know, but I can tolerate it. But is there any food that I can take that decrease this? And I have another question about the
Oh,
spices.
okay. Yeah, sorry. So let me answer your first questions.
Mhm.
Is it related to the radiation? That I cannot answer. So I think you can talk to your consult to the radiation oncologist. I'm sure they can answer better than I do. Is there any certain food which is beneficial to alleviate this metallic taste? Let me see. I'm afraid I haven't heard anything specific. I don't think so. But one thing you can do is the zinc supplement, one of the mineral zinc, Z-I-N-G, zinc supplements. Everyone can take it, and any therapy are you receiving right now, whatever it is, it should not interfere. So zinc is safe supplements, vitamins. The dosage is you will probably found like a 30 milligram capsule or tablet or 50 milligram capsule. Any brand is good. You can go to, let's say, CVS or any pharmacy, supermarket, doesn't matter. I think you can try 30 milligram pill, one pill a day. So not effective, not for everyone, but I think it's worth trying. And it doesn't hurt your body. It does not interfere anything.
I'm actually type 2 diabetic too, so I think this will help my diabetes too.
Yes. Okay.
Yeah.
And you have the second question, please.
Yeah, the second question is that I read over the internet that certain foods like turmeric and black pepper um, will help with preventing the cancer proliferation and stuff. And then I met with my dietitian, the dietitian for diabetes, and he told me that all spices will help, like cinnamon, turmeric, cumin, and stuff. Is this true?
Partially true and partially untrue.
Or
For
at least not
example,
harmful? Or
actually,
at
it
least
may,
does not.
which means it depends, especially for the breast cancer. If that is estrogen receptor positive breast cancer, there's an
Mhm,
animal study, not for the human, actually
mhm.
taking high dose of the turmeric, it may make the cancer even grow, make it worse. So there's no human data, but just in case, if that is estrogen receptor positive, I recommend not to take the over-the-counter supplement turmeric or curcumin. Using the turmeric or curcumin in your diet, like using the turmeric root or using like a 1 teaspoon of the turmeric powder, sprinkle your salad or soup or put in the smoothie like that or protein shake, that's okay. But taking the supplement, like a pill type over-the-counter supplement, we call it's a higher dose of the turmeric. Just in case, I recommend not to do that. So it really depends on what kind of cancer, especially is it estrogen receptor positive or not. So,
Yes, mhm.
right.
It is
So,
estrogen, actually. Yes.
okay, yeah. So, sorry, this today is not just to give you the general information, but what I can
Okay.
say is not always safe. At least I want you
Thank
to,
you.
yes, I'll let you know, not always safe. It really depends on your condition, depends on your cancer type, depends on what kind of treatment are you receiving. So we have to see several factors altogether and make a recommendation to you.
Okay. Thank you so much.
Thank you.
Anyone have any other questions for myself, Dr. Umeda, or Jim and Gabby in the kitchen? All right. Well, thank you all for attending, and please take a moment to complete the program evaluation on the link on the QR code that's on this slide.